From Central Indiana's #1 news source, this is Fox 59 Tonight.
Good evening. Thank you for joining us here on Fox 59 Tonight. I'm Cameron Riddle. We appreciate you downloading our smart TV app, Fox 59 Now. You'll find it on your Roku, Fire TV, Apple TV, and now on Samsung TV. Also, hit the subscribe button if you're watching us on YouTube so you never miss the conversations that we get to have every night at 8 o'clock here on Fox 59 Tonight. Hey, look at the calendar. Do you know what month it is? It is October. That means it's fall, hence why I'm wearing fall colors, because we got to get into it, right? But not only the colors that I should have wore today are not only this, but I guess I also should have worn pink because it is Breast Cancer Awareness Month. And unfortunately, it's something that far too many of us deal with and know people who are dealing with, living through. But maybe it's something we still don't talk about enough. And there's never a good time for cancer to enter somebody's life, but it does happen every day, year round. People of all ages. Somebody who knows that very, very well for a multiple number of reasons is in our studio. Nadia Miller is the founder, if I get that right, co-founder of Pink-4-Ever, which you will find out about Pink-4-Ever Day this month. It is happening this month. It's an actual day in Indianapolis as proclaimed by the city county council. We'll tell you all about what's happening on October 30th at P30 at Pink-4-Ever Day. But first, tell us, what is Pink-4-Ever? Hello, Nadia Miller.
Hi, Cameron. How are you? Thank you for having me.
Absolutely. Glad to have you. Thank you for the work that you do. I know there's a story behind it, and I want to hear all about it. As we said, this is Breast Cancer Awareness Month. What are you guys doing this month on the 30th and year-round that has to do with breast cancer?
Well, Pink-4-Ever, for those that don't know, is a breast health organization that provides services through to the community through 4 pillars of education, advocacy, research, and empowerment. And so all the programming that Pink-4-Ever has is established under those 4 pillars, and that's how we produce our programming. What we've been doing all month long is everything under those 4 pillars that you can imagine, from educating the community to providing advocacy to the community, and then, of course, making appearances and speaking and teaching in different spaces and places, work, church, people's homes and schools, to bring awareness to breast cancer and breast health, but mainly also to provide services and also programming to the community that are free.
Some would say that you could describe what you do as a wraparound service because you're in multiple different chapters or phases of the breast cancer journey, battle, and recovery. Talk about what those 4 different pillars are.
Well, the reason why we established 4 pillars is it's exactly what you said, to address the continuum of care, the entire continuum of care. And we believe at Pink-4-Ever, but that you cannot do that with being in only one area, but we have to be very strategic about how we do that. And so the first pillar is, and not in this order, but let's talk about advocacy. Advocating for not only yourself, but advocating for someone else. So we actually have advocates. We have over 100 and some advocates dispatched throughout Indianapolis, specifically in churches and other spaces that are trained to go out and provide fact-based information for individuals who are either going through treatment that need information, or to create programming within a specific space so that there's education, like fact-based knowledge, to help dispel some of these myths. The other pillar that we have is research. So Pink-4-Ever has a strong foot in research. What do? We partner with hospital groups like IU Simon Cancer Center, which is, we partnered with them for well over a decade. We are a part of their clinical trial studies. Because without clinical trials, they cannot make personalized medicines and interventions for people of color specifically. So when there's clinical trials, non-invasive trials, which is, hey, may I speak with you and find out what your family history is? Can we pass that along? Pink-4-Ever has done that for quite some time so that we can be at the table while they're trying to develop drugs and interventions for individuals that are at a higher death rate, which are women of color. Empowerment. We have different programmings around empowering individuals to take control of their health. Not only about breast cancer, but about lifestyle choices. Also introducing things to the community that they may not understand, that, look, this lowers your risk, if anything else, as far as just women are concerned. We'll get to men in a minute. But with women, I mean, the number one risk factor is that you are a woman. It's like prostate cancer for a man. The number one risk factor is that you're a man and you have a prostate, right? And so under that pillar, we do the same thing to make sure that people are informed, and we're taking it to you. So we don't want to wait on folks to come to us to get the information. And lastly is the support. We provide financial assistance through our Nadine Whitlock Hayes Fund, which are for individuals who are in active treatment for breast cancer. That means we pay your utility bills. Unfortunately, we had to do burial expenses, and there's a committee that reviews the application, and that is available for anybody under the guidelines. Like, they do have to meet certain guidelines, but we tried to remove whatever barrier we possibly can as an organization to get in front of not only the patient but the family.
So that is what you guys do year round. Coming up on October 30th, it is Pink-4-Ever Day, as proclaimed by the City County Council. What is happening on Pink-4-Ever Day?
Okay, on Pink-4-Ever Day, we are partnering with P30. We are taking over, I believe it's 3039
North Post Road.
And we are pinking out the place, but we are, again, saying thank you to the community, number one, for their support. And so it is free everything. We want you to come meet and greet the individuals that are behind the boardroom doors. So our advocates will be there. Folks that are running the programming will be there. But most importantly, we want to say thank you to the community. So there's a day carved out just for you. This is a free event, if you will. It's from 3 to 7 p.m. I will be there. Our board members will be there, advocates, supporters, and this is open to the whole community. And most of all, we want some folks to come in the door and leave with something, leave with information that they may not have had. I mean, again, there's all the bells and whistles. There's merch. There's free food. There's chefs that there. But most importantly, we want folks to come in the door and leave with some information that maybe they don't need, but they can pass on to someone else. And we want to thank the Indianapolis community for just their support. We'll be 19 years old next year. So just thanking them for their support.
Well, I was going to ask you to take us back as you go 19 years. How did this begin? What is the origin story of Pink-4-Ever?
Well, Pink-4-Ever Inc. started. It actually started in 2005. It would germinated in 2005. My older sister named Nita Ray Miller, she passed away of breast cancer. And then 2 years later, I was diagnosed with breast cancer. And I was 27, I believe. And, just thinking about it is quite interesting. And so during treatment, my brother John would come sit with me. His background is in healthcare. He's also a entrepreneur here in the city. But I was complaining to him about hey, like you can with your brother or your sibling. I don't see any information that with anybody on here that looks like me. I was diagnosed very young, but I also had a lot of things going on that required me to have multiple surgeries. I had a year of chemotherapy, so I didn't have hair. Where do you get a wig? I had to have, because I am BRCA positive, which means I have a genetic mutation for breast cancer, and it increased my risk. So I had to have both of my breasts removed. Where do you go get a prosthesis.
Mm-hmm.
There were all these things going on. So my brother said, why don't we think about what this looks like? What do you want to do? Well, at
Mm-hmm.
the time during my diagnosis, I worked for a diagnostic company. My background is in clinical trials. And so I kind of understood how it could work. And mainly, firstly, let's start talking about it and creating imagery with individuals that look like us.
Mm-hmm.
Now, keep in mind, this is 19 years ago. If you think about it, 19 years ago, you were not seeing faces like mine on literature
Mm-hmm.
or talking about or encouraging individuals that there were resources available for you that would look like you,
Mm-hmm.
that would help you.
Mm-hmm.
We didn't know. And so that's how Pink-4-Ever came about. I journeyed and continued to work. I began to speak and teach. We built a board of directors over the years. And in 2021, Pink-4-Ever Inc. merged with another organization called the Red Alliance.
Okay.
So we acquired this organization because we were competing almost for funding, and we basically had the same mission and vision, which was to
Mm-hmm.
reduce the disparity rate
Mm-hmm.
of Black women within the community. Okay,
Mm-hmm.
so once we did that, the organization became Pink-4-Ever Ending Disparities.
Mm-hmm.
And the reason why that was most important is the Avon Foundation, same story, came back and said that Indianapolis, this is back in 2014, said that Indianapolis was one of the top 10 cities
Mm-hmm.
that had a 42% death rate of women of color.
Mm-hmm.
That's why the Red Alliance was birthed. We
Mm-hmm.
got busy in the community, lost funding. Pink-4-Ever Inc. comes to the table and says, this is what we're going to do and why.
Mm-hmm.
So now we have a foot in research, right? And so John and I, over the years, have continued to talk about the why. And it was so important, not only for me, but we've seen the impact on our family.
Mm-hmm.
We've seen the impact on the Miller family. And so this is how that happened. And to be honest with you, when I look at it, I am so grateful and thankful, because some days I wake up and I'm like, how did we get here?
Mm-hmm.
But it was a concerned brother
Mm-hmm.
about his family.
Mm-hmm.
That's how we got here. And then over the years, I mean, we have a wonderful executive director, Lisa Hayes, who's also a breast cancer. She's an 18-year breast cancer
Mhm.
survivor. So we're speaking from spaces of that we know,
Mhm.
but we're also speaking from a business perspective, a strategy perspective on how to address the needs, the continuum of care within the Indianapolis community that just started with a brother and sister that had lost their eldest sister, and then his younger sister then
Mhm.
became a survivor as well, just like that.
So I'm always interested when people go through something good or bad, um, and instead of just putting that moment behind them, it causes them to strike action into something. And I obviously I can still hear you used the word interesting when you were thinking about your sister and thinking about what you went through, but I can see that still took you right back to a place. So I'm gonna ask you about that, and if it's somewhere you can't go, then just let me know. But I'm thinking about you as a 26-year-old, 27-year-old woman who would have been in college or coming out of college at that time. Um, I'm assuming only because your sister had breast cancer and passed from it in the first place is the only reason you even got tested for it.
Yeah, your assumption is correct. I think that, just to be completely honest, it does take me back mentally. You know, she was very young when she passed away from breast cancer. But when I found my lump, the first thing that didn't first thing register was like, hey, you probably got breast cancer.
Mm-hmm.
But I did know that there was an awareness because I knew what breast cancer I knew what it looked like,
Mm-hmm.
but it still, I didn't think
Mm-hmm.
that was going on with me, but I did know that I needed to get checked,
Mm-hmm.
And so because of watching Nita's journey, which she made it look so easy,
Mm-hmm.
I did have an awareness that, oh, okay, yeah,
Mm-hmm.
I need to go to the doctor. And
Mm-hmm.
then again, impacting the family, my mother, I'll never forget it. We were inviting family over to the house to watch the Colts game.
Mm-hmm.
And she came in the door and I'm like, hey, Mom, come here. Oh, you can only do this with a mother. Like,
Mm-hmm.
what are you thinking? I put her hands where I thought I had felt a
Mm-hmm.
lump. And
Mm-hmm.
she said, oh, okay, well, yeah, you should just go get it
Mm-hmm.
checked out. And that started the journey.
Okay.
One after the other, one appointment after the other appointment. I went to 2 appointments. You know what? We don't think it's anything. You're so young, but let's send you to
Mm-hmm.
have an ultrasound.
Mm-hmm.
Get to the ultrasound technician. You
Mm-hmm.
know what? You're young, but let's just go on and get you on over to a surgeon.
Mm-hmm.
And I will always remember Dr. James Crossan. He's retired now. He took one look at me and said, "Yeah, you are young."
Mm-hmm.
He said, "But let's still do an excisional biopsy and let's see what this is."
Mm-hmm.
And 3 days later, he called and said, "Hey, you want to come in and see me because it indeed is a malignancy.
Mm-hmm.
You have breast cancer."
Mm-hmm.
And
And at that time, had you already lost your sister?
yes, 2 years prior to that.
Okay.
And so it was
And she was 30,
mhm,
and you're now 27.
mhm.
And what are you thinking at that time?
During the diagnosis,
Mm-hmm.
this can't be real. What the kids say, this can't be real for real.
Mm-hmm. Mm-hmm.
you know, however, it was not about, I had made up my mind in the office. I'll tell you exactly what happened. I had made up my mind when I went to see the doctor,
Mm-hmm.
when he asked me, and it wasn't just me,
Mm-hmm.
my whole family, because
Mm-hmm.
again, we just, this can't be
Yeah.
happening.
Mm-hmm.
My parents just buried their oldest daughter, and now here goes another one.
Mm-hmm.
And I remember I made up my mind when I left the office
Mm-hmm.
that, because I had a 2-year-old little girl at home,
Mm-hmm.
that I was going to do whatever I needed to do.
Mm-hmm.
And it sounds cliche because you hear it so much, but
Mm-hmm.
nah,
Mm-hmm.
I had made up my mind that whatever was going to go on, that I was going to live
Mm-hmm.
whatever that meant.
Mm-hmm.
Didn't know what I was saying though.
Mm-hmm.
Because I had to journey. That's
Mm-hmm.
why it's called a journey. There is a journey, and so that's how it happened for me. Because of, in hindsight, watching your sister for years, and then it unfortunately she succumbed to the disease, and then here I go.
Mm-hmm. You talked about you had a 2-year-old, so
Mhm.
that was your, that's where your mind went. I got to do whatever I need to do to be here for her.
Yeah.
I'm wondering, especially for a young woman, 26, 27 years old, in the most respectful way, that is when you're a woman,
Yes.
I would imagine, and this is the part we don't talk about.
Mhm.
I would imagine that it would probably be difficult, and tell me if I'm wrong, that you sometimes have to have conversations with the woman, like you are going to lose your breasts, and that in a lot of ways is how we consider you are a woman.
Yeah.
How do you have that conversation? What was that like for you? And is that now something that you have to have that conversation with, like, as you depart with this part of you, you are still you are still a woman, and this is not the end.
Absolutely. Absolutely. For me, when I say I made up my mind, I had to make up my mind to make a life decision and not a cosmetic decision.
Mm-hmm.
And I hope when I talk to my fellow sister survivors, or brother, it's the same thing, men or women. But when I talk to my fellow sister survivors that have to undergo a double mastectomy or even a mastectomy, I hope that they hear my voice, that I've lived it.
Mm-hmm.
And it is not easy.
Mm-hmm.
But there's a difference between having a treatable cancer
Mm-hmm.
than one that cannot be treated
Mm-hmm.
because you chose to make a physical
Mm-hmm.
decision
Mm-hmm.
or a cosmetic decision.
Mm-hmm.
And I would say, coupled with chemotherapy, that was one of the hardest decisions that I had to make. And I'd do it all over again.
Mm-hmm.
And that's the thing I think that other advocates like myself that we built up throughout this organization is to provide people that have gone through it.
Mm-hmm.
But then, and also can tell you, I'll reach across the table and I'll tell you, hey, it's not going to be easy,
Mm-hmm.
but I'll provide you the services that you need, coupled with a lot of other different things, right? That continuum of care to get you on the other side so that you can be here. But yeah, it's not, it's not for the faint,
Mm-hmm.
but you do have to get in a posture where you decide that I'm going to live.
Mm-hmm.
And living includes, I may have to have my breast removed.
Mm-hmm.
Living includes, I may have to lose my hair.
Mm-hmm.
And that has to be paramount.
Mm-hmm.
Your life has to be above everything.
Mm-hmm.
And so often, I will share this with you, a lot of women that have been unable to get to the point where they say, I'm going to allow, because we have to allow
Mm-hmm.
the physicians. It's
Mm-hmm.
not, they can go in there and make all the recommendations,
Mm-hmm.
but if they recommend it and you don't take it,
Mm-hmm.
It could delay, it could cost, and in some ways it can cost you your life if you
Mm-hmm.
if depending upon what your case or your cancer is.
Mm-hmm.
And that's a big deal. That's a great question. That's a big deal.
Mm-hmm.
It is.
I don't mean to be flip or anything about it, but it's one of those where it's like at the end of the day, you can get more hair. Your hair will grow back.
Yes.
You can get new girls. This is not this doesn't change who you are, but if you decide to keep it, as you said, there are consequences. But I think that I've never really heard anybody talk about that part of the journey. And so I would imagine now in your role of serving that this is one of the things that I bet you wish you had was somebody to say, look, you're gonna go through some things, but at the end of the day, this is how you get through it. And that's what you guys are doing with Pink-4-Ever.
Yes. And it's Pink-4-Ever really was birthed because of there was a lack.
Mm-hmm.
There was something that wasn't there. And if it was happening for me, and I was meeting other women too, that was another thing.
Mm-hmm.
I was meeting other younger women that they were acting as if, because we didn't have a platform at the time, like it was a fluke.
Mm-hmm.
But what was happening is, no, the data was really starting to show, and it's like that right now. That now in 2025, the data shows between 18 and 35, and you're seeing it more and more and more and more women being diagnosed at an earlier age.
Mm-hmm.
And yes, I wish. So I didn't have it, so we created it.
Mm-hmm.
I'd say the other day, yeah, we didn't have it, so we created it for the community, so that the things that I did not have, that we were able to give to other families, including the patient.
Mm-hmm.
Because it does make a difference to go to the doctor. And I mean, I don't do this all the time. But we do have advocates. I go to the doctor with them, or if someone's having a problem, because we can provide a lot of different aspects. It also helps the physician as well. With the trust thing is still there too. So somebody saying, hey man, while the doctor just said you have to do this, I have had to talk to multiple women over the last 3 months about just having them go to chemotherapy because they didn't want to lose their hair. So what do I say? Hey, no problem. Let me get on and call one of my partners, Shar's Medical, Sharitha Brown. Let me call her. She's located right over here and let me get you do you know that having hair, believe it or not, made a difference between whether it's go or no. So we make sure at the organization that we have partners, because as silly as it sounds, I tell everybody this, until you have to put on those shoes, like in real life, what we best do is provide the resources for individuals so that they can live, or until they get to the point where they're strong enough to take off running, because it is, anything like that can be certainly devastating.
We've talked a lot about women naturally with breast cancer, but we've heard more and more men also being diagnosed with breast cancer. What does that space look like for you guys? And when should both men and women start to look or get tested for breast cancer?
Well, the space Pink-4-Ever in with as far as male breast cancer is that we're in it, meaning that number one, there has to be awareness that it actually exists.
Mm-hmm.
Debunking myths that no, men don't get breast cancer,
Mm-hmm.
or a man that got breast cancer, he's a fluke. It's not a big deal. That doesn't
Mm-hmm.
happen. Something was going on with his family, or he has some sort of genetic mutation. And while
Mm-hmm.
that may be true, it's really about lifestyle and awareness. So Pink-4-Ever is number one, it does exist in males. It does happen. What's the ratio? Statistics about it.
Mm-hmm.
Coupled with, hey, you have to ensure that you are having regular appointments,
Mm-hmm.
right?
Mm-hmm.
For your overall health care.
Mm-hmm.
And then empowering men, women, and families to make sure they're taking the next step, which is you got to go to the doctor.
Mm-hmm.
If you don't have one, we're a resource to help you get one in real time,
Mm-hmm.
right? And then the other thing with men is also ensuring that there are some correlations with cancer, right? I'll give you a great example. I'm BRCA positive, which means I'm BRCA1. There's BRCA1 and there's BRCA2.
Mm-hmm.
BRCA1 increases your for a woman increases your risk of breast cancer. The thing is that my brother, it would increase his risk for prostate cancer. You see?
Mm-hmm.
And then, so there's these things about your family history that you have to get to know or to cost you. As far as men are concerned, and I've said this all the time, number one, they need to be aware of their family history about what's happening in their family with cancer, period. The other thing is we have to make sure that men are going to the doctor and being empowered to go to the doctor
Mm-hmm.
about their overall health.
Mm-hmm.
And then if you have a problem, same thing, being able to go to the physician and talk to them about it. And Pink-4-Ever is very open to what is evolving within breast health and breast care for men, because it is absolutely occurring more often than it was 10 years ago.
We're just about out of time, but
Okay.
but I could keep talking to you about this for a while. That just means you'll have to come back.
Oh, I would love to. We could do a part two.
Because as this is Breast Cancer Awareness Month, and you have Pink-4-Ever Day, come November, this is still a problem that you guys are working through.
It's 365. This 365 Pink-4-Ever or breast health awareness is every day, not only for the Pink-4-Ever organization, but it's every day in the lives of people.
What ages should people start going to the doctor?
Well, typically, if you don't have any family, you should go to the doctor once a year. But if you're going
Correct.
for an annual screening, as far as a woman is concerned, it really depends on what's going on in your family. But if you have no symptoms, no family history,
Mhm.
anything like that,
Of
your
any kind
typical
of
screening
cancer?
of 40. Yeah.
40. Okay.
And your guidelines will say 40, 45, 50. What I'm saying it to women, and this is the thing, I challenge all of you to make sure you're going to the doctor about your breast, but then also making sure you're having the conversation. And if you have a problem, to say so. Because if I would have waited till I was 40, I'd have been dead.
I was thinking about that. If your sister had not gone through that, when would you have ever gone to the doctor? I mean, you found a lump,
Right.
but maybe you would have ignored it. Maybe
Right.
you wouldn't have known what it was.
Absolutely.
The website that you have here, Pink-4-Ever, pink-4-ever.org. This is where, if you guys are watching, you want to find out more information about the organization. If you know somebody who is going through the journey of breast cancer, man or woman, or if it is you, Nadia, I'm sure you would love to hear from some folks.
Absolutely.
I bet you'd also like to hear from some donors, some volunteers.
Absolutely.
Because I would assume much, if not all, the things that you offer to the patients going through the journey of breast cancer is free, but the services that you are providing are not free.
That's correct. So
how can folks donate, get in touch, all that?
yeah, folks can. Well, first of all, we're located here in Indianapolis. Our headquarters it's on West 86th Street, 3901 West 86th Street on the second floor. It's the entire second floor. You can't miss us. And we're open from 8:30 to 5 p.m. every day, Monday through Friday, unless it's a holiday. The other thing is that absolutely we are a 501c3 nonprofit. We accept donors, and you can donate in many different ways to the organization under the 4 pillars, or you can make an open donation by just going to the website Pink-4 ever.org, and you can just click donate, and you can even pick where you want to donate at. Also, to our partners, we continue to have, of course, grant funding for those things, but we're really trying to empower the community, because 100% of what is donated to Pink-4-Ever does not go to pay salaries. It goes right back into programming, and that's something that people need to know. It goes right back into programming to continue to pay for those programs. And then our colleges, our young ambassadors, our junior ambassadors, they have a pillar under education as well, so that we can go on this college tour during the month of October and then continue to give them the platforms that they need. So yes, I would ask everybody to check out the website, or hey, you know what? Come stop by. You are feel free to stop by the office. It's open to the community. Our executive director, office manager, I'm running through there from time to time, and we would love to see you. And guess what? You can also come and register for a mammogram on the spot to have a free mammogram. And you will go to one of our partners, either Franciscan or Northwest Radiology, who takes walk-ins the same day. So we would love to see you. And I'm not just saying that. Come on in, Cameron. Come on in and see us. But that's absolutely how you can get a hold of us. We have and then also, I would encourage you to go to the website and see all the things that are available and see who's actually really behind Pink-4-Ever. I have the great opportunity to be one of the leaders of this great organization alongside Lisa Hayes, but we have a very comparable board that also has assisted us with their network.
Gotcha. Well, thank you for everything that you do. You've been around going on 20 years, so congratulations of that. Congratulations on being a survivor, but also thank you for taking what was a moment of pain, and you could have just left it there, never thought about it, but you've literally made that, what you went through, your life's work, to make easier for other people. So thank you for what you've done and continue to do. All right, pink4ever.org, pink-4-ever.org is the website to find out more. That's going to do it for this edition of Fox 59 Tonight. We'll be back with more every night at 8 o'clock. And of course, you can always listen to me on the radio Sunday mornings on 106.7 WTLC and Hot 100.9 for open lines. Until we talk again, good night.